Are you looking for ways to rekindle the romance in your relationship? We have some tips, plus exercises and devices that can help supercharge your love life. Then, proven ways to help ease performance anxiety. That's next on Sex Talk.
Welcome to Sex Talk, where we answer the questions you've always wanted to ask about sex and relationships. I'm Dr. Leah Janine, Associate Professor in the Department of Health and Human Performance at Nova Southeastern University. And joining me today is Sex Talk correspondent Derek Latta.
Dr. Leah, a pleasure to be here as always, and great to see you.
It is great to see you as well.
Thank you very much. Are you ready for these great questions?
I am.
Here we go. Our first question. My partner has performance anxiety. Is there anything I can do to help?
Performance anxiety in the bedroom is more common than people realize, and it can affect both men and women. When your partner struggles with sexual performance anxiety, it can create tension in your relationship and leave you feeling unsure of how to help. But I'd start with getting a good understanding of what's happening. This anxiety can manifest before or during sexual encounters, making it difficult for your partner to maintain an erection, become aroused, or achieve orgasm.
So you can't have an orgasm if not aroused, and you can't be aroused and have an orgasm.
Yeah, anxiety is just not good all around.
Okay.
It's the start of this bad cycle.
Talking about anxiety, is this more common for men, by the way?
Well, this condition can actually affect both men and women. It's more commonly reported in men, where it can sometimes lead to erectile dysfunction. Studies suggest that 9 to 25% of men and 6 to 16% of women experience some form of sexual performance anxiety. This anxiety can create a vicious cycle where the fear of poor performance leads to actual performance issues, reinforcing the anxiety.
You know, before I ask what the signs are to these anxiety problems, my philosophy is that men, we have a lot of pressure. We have a pressure to sustain
Not just
a
men,
family.
Derek. Not just men.
Let me finish.
Not just men.
Hold on a second. I agree, not just men.
Okay.
But for whatever reason, men think that we have to provide. We're the providers. We have to be knowledgeable in bed as well. And if we're not, where have you been? What kind of guy are you? Would you say that might be one of the reasons, or?
Well, and I think that men just get too hyped up about it. Like, they think that they have to be like the best in bed ever. I think that a lot of women, it isn't as high on their priority list to necessarily be the best sexually. Whereas with men, it's like all about the ego. Like, I've got to be the best, But this is true of performance of anything. They actually had a study of basketball players, and basketball players that were reviewing their plays prior to going out there actually performed poorer than basketball players who just told themselves, I'm going to be great, I'm going to be amazing, I'm going to do wonderfully. And so that positive self-talk can go for the bedroom or on a basketball court.
Okay, so just transfer that from the court to the bedroom.
There you go.
Okay.
Exactly.
No half-time, no intermission, anything like that. Okay.
Well, you might need a water break. I mean, it just depends.
Some hydration.
Exactly.
What are the signs for that men might have difficulty achieving, I guess, and maintaining an erection? I mean, we know what the sign is. You don't have an erection. That's a sign.
Well, Well, some signs in men are difficulty achieving or maintaining an erection, premature ejaculation, and lack of interest in sex. For women, signs could be vaginal dryness, difficulty becoming aroused, and pain during sex. The symptoms do vary and can be easily confused with other sexual dysfunctions, but the underlying cause is psychological rather than physical.
So how can a partner or this viewer help in this case?
Well, encourage an open dialogue about the anxiety. Approach the conversation with empathy and without judgment. Let your partner know that their concerns are valid and that you're there to support them. Reassure your partner that your focus is on enjoying the experience together, not on achieving a specific outcome. Sometimes taking the pressure off can alleviate anxiety. Shift the focus from performance to intimacy. Engage in non-sexual activities that build emotional closeness, such as cuddling, talking, or spending quality time together. And don't dismiss professional help, like a therapist or even medication.
I hope we're able to answer your question, viewer. I think we did. Okay. Our next question. How risky is it to have a partner that has HIV?
While HIV transmission can occur after just one exposure, the probability of transmission varies greatly depending on the circumstances. For example, anal sex carries the highest risk. Studies show it can be up to 18 times more risky than receptive vaginal sex. The presence of STIs, vaginal conditions like bacterial vaginosis, or high viral loads, particularly during acute HIV infection, can also increase the risk of transmission. For example, during acute HIV infection, the risk of transmission during receptive anal sex could be as high as 20% per exposure.
Receptive vaginal sex, receptive, what's the difference?
You're
why
the
is it
receiver.
receptive?
So you're the receiver. So think about like the penetrator and the receiver.
Got it. Okay, the catcher in the pitcher.
There we go.
Okay. Thank you for the explanation. If you have sex more than once, is it riskier? Is there more risk involved?
Well, yeah. Repeated exposures can significantly increase the overall risk. For instance, if a woman has unprotected vaginal sex 100 times with an HIV-positive partner, her cumulative risk could be approximately 10%, and even higher if other risk factors are present.
And what can you do to reduce the risks?
Use condoms. They're highly effective when used correctly. Always use a water-based or silicone lubricant to reduce the chance of the condom slipping or breaking. There is also pre-exposure prophylaxis, or PrEP, which is a medication that can reduce the risk of HIV transmission by up to 99% when taken daily. It's particularly effective in preventing transmission through sexual activity. And then see if your partner with HIV takes antiretroviral therapy and has an undetectable load. Undetectable basically means it's untransmittable. Let's take a look what this doctor has to say.
I want people to know that it's still prevalent in society.
Dr. Stacy Rizza says HIV attacks and weakens the immune system. It destroys a type of white blood cell called CD4, which protects against infections. Dr. Rizza says most people in the early phase of the disease often don't know they have it.
It can hide away in the body in a latent state for many, many, many years, and that's why it's so difficult to cure HIV.
If you're HIV positive and unaware of your status, you can unknowingly transmit the virus to others through sexual contact or by sharing needles.
HIV prevention is using barrier protections like condom or dental dams or female condoms.
Screening for HIV can help detect the virus early, and knowing your status enables you to prevent spreading it to others.
I would love for more of society to get tested for HIV and then connect those who are infected to care so we can take care of them and give them long, long, healthy lives.
That was super interesting. Let's take another question, Dr. Leah. Is there a way to make condoms feel better for me and my partner?
One simple trick to improve sensation is to add a few drops of water-based lubricant on the inside and outside of the condom before putting it on. Most condoms come pre-lubricated, but adding a little more can enhance sensation further. Plus, there are so many options when it comes to condoms. There are different textures, different materials, so maybe try something different. You could get ridged condoms for added sensation or extremely thin ones that feel like you're almost not wearing anything at all.
That's a great tip. Before we go on to other tips, you mentioned lubrication inside the condom. Wouldn't that have a risk of slipping?
Well, if you have too much lubrication, it can. So you just want a tiny amount of lubrication on the head of the penis. Too much lubrication is also bad. That could cause a problem.
Interesting. Okay. Any other tips, Dr. Leah?
Well, have fun with putting the condom on. Sometimes the way you put on a condom can set the tone for the entire experience. Instead of viewing it as a necessary but unexciting step, incorporate it into your foreplay. For example, your partner could use their hands or even their mouth to apply the condom, turning what might be a mood killer into a sexy, intimate moment. And have a good mindset. If you're preoccupied with the worries about STIs or pregnancy, it can be difficult to fully enjoy the moment. Condoms are there to help, and if anything, you can get help to let go of some of those worries.
Condoms to the rescue.
There you go.
There's also flavored condoms
flavored
in different
condoms.
colors.
Yeah, I mean, particularly for oral sex, because other diseases can be spread through oral sex.
That's true.
So if you want to be extra cautious and don't want to taste rubbery flavored, then you could have flavored condoms or any flavored lubricant on top of it.
Beautiful, thank you. Our next question, Dr. Leah. What is a good age difference in a relationship?
In many cultures, heterosexual relationships where the man is older than the woman are still the norm. A 2017 study found that couples with a 1 to 3 year age difference, with a man being older, reported the highest levels of relationship satisfaction. Satisfaction tends to decline as the age gap increases. Another study from Korea found that couples with larger age gaps were more likely to experience depression, particularly when compared to same-age couples who had the lowest rates of depression. These findings suggest that in many cultures, an age gap of 1 to 3 years might be ideal. But it's important to remember that numbers don't tell the whole story of the relationship.
Our next question, Dr. Leah. How can I enjoy sex with gender dysphoria? What is gender dysphoria?
Well, gender dysphoria can just be feeling like you're not really in the right body. Right. So, and there's a wide range of various types of gender dysphoria, right? And gender dysphoria can certainly cause discomfort, anxiety, or even disconnection during sex. But know that you're not alone in this experience, and it is possible to have a good sex life that feels affirming. First of all, sex isn't one size fits all experience. It doesn't have to involve certain body parts or follow any traditional scripts. You and your partner are in control to define it the way you want. It might include acts that don't focus on genitalia or involve activities like kissing, touching, or mutual masturbation.
You know, I like that you said that sex is not one size fits all, which is true. So we shouldn't have these preconceived notions that you have to be a certain way.
I think that's like one of the biggest sex and relationship killers. Mm-hmm. So whether it's heterosexual sex or homosexual sex or someone with gender dysphoria is just presuming that you have to follow some norm. I mean, you see how many questions we get with people that are like, how often is normal to have sex, right? And it really just depends on what works for the couple.
I'm going to keep on picking your brain. What's some other tips?
Solo sex can be a good way to explore what feels good to you. It helps you understand your body and can prepare you for sex with a partner. Also use affirming language. The language you use to describe your body parts can significantly impact your sexual experience. If traditional terms cause discomfort, choose words that better align with your gender identity. There are also plenty of gender-affirming tools and toys that can be used to help you feel more connected to your body and your partner.
Dr. Leah, we've had before in the past questions and answers on how a man could have a stronger, harder erection. So I think that this next question is a woman's turn.
Okay.
Here we go. She asks, are there tools or apps to help strengthen my vagina?
Yes, there are several options. There are Kegel weights. These weights, often shaped like balls or cones, can be inserted into the vagina. Holding them in place without letting them fall out helps build muscle control. As you progress, you move from lighter to heavier weights, enhancing your pelvic floor strength over time. There are electrical stimulation devices that provide a small, painless electrical current to the pelvic floor muscles, causing them to contract automatically. These devices can be used internally or externally. Internal devices involve inserting a probe into the vagina, while external devices are less invasive and can be worn like a pad inside your underwear. There are also biofeedback, which is a technique that allows for you to see your pelvic floor muscles in action. Using sensors and a monitor, biofeedback shows you how well you're contracting and relaxing your muscles. This visual feedback helps you understand your muscle activity, making it easier to strengthen your pelvic floor over time. And then there are also some FDA-cleared at-home devices designed to strengthen your pelvic floor muscles and treat urinary incontinence, like the Leva Pelvic Health System.
Wow, that's a lot of options, a lot of physical things. Are there any apps that will help?
Well, there are a lot of Kegel exercise apps, actually. They will typically guide you through different Kegel exercises, help you set goals, teach proper form, and track your progress. Some examples are Squeeze Time, Easy Kegel, and Kegel Trainer PFM exercises.
Obvious question, who can benefit from these exercises?
Well, anyone who could benefit from Kegel exercises can use these devices. They can be particularly helpful if you're new to Kegels or you need assistance in identifying and isolating the correct muscles. As you become more comfortable with these exercises, you might eventually do them without the aid of a device. But you will want to consult a physical therapist before starting a Kegel exercise plan, especially if you're unsure whether or not your pelvic floor is too tight or too loose.
By the way, it's not just for women, but in this case it is to strengthen the vagina, but there's Kegel exercises for men too.
Yep.
Absolutely.
Yeah,
Correct.
men can strengthen their Kegels, so it can also help with the rate in which a man ejaculates. So yeah, so you just, for men, just it's the same muscles you want to contract, but kind of like if you started peeing and then you got to stop peeing all of a sudden, it's the same muscles. But don't do it while you pee. That can cause a problem. So you don't want to stop your peeing too many times. But it's the same muscles that you would use to stop your pee. Okay. And you can do them anytime.
Okay, better mind. Thank you. Anyway, our next question, Dr. Leah. Why does my libido seem to change when I get into relationships?
It's typical for people to notice a change in their libido when they enter a new relationship. What starts as an intense, passionate connection during the early stages often evolves into a more relaxed and comfortable dynamic. The first few months of any romantic relationship are often referred to as the honeymoon period. This is that time when both partners are usually on their best behavior, trying to impress each other. During this phase, sexual desire tends to be at its highest. It's the excitement of something new and thrilling. As the honeymoon phase ends, you may notice a drop in sexual desire. This is completely normal. The relationship becomes more about companionship, trust, and comfort, rather than the constant need to impress and engage in sexual activity.
You know, this honeymoon phase can apply to a lot of different things, like buying a new car. You love that new car smell, new car and everything, new buttons and everything. After a while, like,
I'm
okay,
over
let
this
me
car.
get rid of this guy. Right?
I'm sick of this car. And even your house, right? Like, people can get sick. Like, my father bought a new house that was like same square footage, pretty much in the same neighborhood, and he was just like, yeah, we were just sick of the old house. I'm like, what? That does not seem like the best investment decision. But hey, if you're, you know, that just happens.
Or start fresh, something new, you know.
Yeah,
it's nice.
but you got to, be aware of the appeal of something new. So I recently actually read a study that showed that a lot of times people will wander because their partner might fulfill 80% of what they want, and they'll find somebody that fulfills that missing 20%, and then they go for it. But then they forget that that person is missing the fundamental 80%. So you want to be cautious when just trying to find something new.
Kind of like the grass is greener syndrome. And sometimes when you get to the other part, it's, again, the honeymoon phase will also there's a honeymoon phase, and it's going to wear out also. How can we make this honeymoon phase last longer?
Well, the honeymoon period is exciting and intense, but real life is a little more complex. It's messy, sometimes boring, and full of challenges. This doesn't mean that you have to lose the spark with your partner. Instead, it's about finding ways to keep the relationship exciting and sexually fulfilling over the long term.
So what are some examples to reignite the spark?
There are a few ways to reignite the spark. Consider trying new things in the bedroom, like experimenting with toys, role play, or even talking openly about your fantasies. Making sex an event rather than an afterthought at the end of a long day can help keep the excitement alive. It's also helpful to break out of your routine. Plan spontaneous date nights. Try having sex in a new location, or simply make a conscious effort to continue impressing each other just like you did at the start.
And how do you know if it's a natural progression of the relationship kind of maybe dying off, or is it the libido? How do you know the difference?
Well, several factors can influence libido, including medical, individual, interpersonal, and societal elements. Hormonal changes due to aging, pregnancy, or menopause can cause fluctuations in sex drive. Stress, fatigue, self-esteem issues, and even relationship dynamics play significant roles as well. The length of the relationship can also impact sexual desire. Monotony and overfamiliarity can dampen sexual interest, while emotional intimacy tends to enhance it.
Do you have any tips for our viewers to manage the libido changes?
As always, communicate with your partner so that they can work with you and support you. If your partner is experiencing challenges, don't judge and try to understand where they're coming from. You might have to meet halfway or might be creative to make intimate moments happen and maintain your connection, like scheduling sex, redefine sex, exploring different types of closeness and intimacy. If you're concerned about your libido, talk to your doctor. There are a lot of ways that they can help. There are medications, even newer ones for women. Let's take a look.
We do have one drug on the market already that is called flibanserin, and it was approved a couple of years ago now for low sexual desire. It works through different brain chemicals than the bremelanotide. Flibanserin works on the serotonin and dopamine brain transmitters, whereas bremelanotide is working on melanocortin. Both of these drugs are working on increasing those brain chemicals that are excitatory and reducing the chemicals that are inhibitory. Now, bremelanotide is just working on the excitatory end with melanocortin, and flibanserin is working on decreasing serotonin, which is inhibitory, and increasing dopamine, which is excitatory.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.
Dr. Leah, next question. What determines sperm health?
When a doctor is looking at sperm health, they're looking at the quantity, movement, and structure. Fertility is more likely when a single ejaculation contains at least 15 million sperm per millimeter. With mobility, it's about looking at the ability of sperm to move efficiently through the female reproductive tract to reach the egg. At least 40% of sperm should be motile to increase the chances of conception. The more motile the sperm, the higher the likelihood of fertilization. And the structure of a healthy sperm is having an oval head and a long tail.
And Dr. Leah, what can affect the sperm health?
A lot of medical conditions can affect sperm health, like testicular disease, sperm transport disorders, and then there's always age. As men age, sperm motility and normal sperm count often decrease, particularly after the age of 50.
You know, I know smoking is bad for sperm.
Yeah. Bad in general, bad for the lungs too.
Right, any kind of smoking, right?
Yeah, any kind of smoking. Smoking, actually, you know, people just think of it as increasing lung cancer, but in reality, I mean, it increases your likelihood of a whole bunch of different cancers.
Okay.
So.
Cannabis as well?
No, well, there's some studies that are showing the danger of smoking cannabis in terms of your lungs, but research is mixed. Most people feel like no if you're eating it and consuming it, things like that.
And what else should they avoid?
Right. Smoking is linked to lower sperm counts and decreased motility. Excessive alcohol consumption can reduce testosterone and sperm production. Some lubricants may hinder sperm motility. Opt for fertility-friendly options if necessary. Contact with pesticides, lead, and other toxins can decrease sperm quality. Protective measures like wearing safety gear can help with those situations. And high temperatures can mess with sperm production. Consider wearing loose-fitting underwear and avoiding prolonged exposure to heat sources like saunas and laptops.
Yeah, as a matter of fact, those hot tubs are like 104 degrees Fahrenheit, right?
And sometimes you could even hike them even higher than that, like depending on your own settings.
Wow.
So,
Okay.
yeah, not good for the boys.
What do you recommend for healthy sperm? How do you create healthy sperm?
Making small lifestyle changes can lead to better sperm. Having a healthy weight can help with sperm count and motility. Of course, you want to exercise and eat a healthy diet. It's always good. Avoiding STIs and stress can help too.
What about the typical question about supplements and herbs?
Oh yeah, we're always getting those. Well, there are various supplements that can boost testosterone levels and sperm count, although more research is definitely needed. Antioxidants like vitamin C and adequate levels of vitamin D can improve sperm quality, but their effects may vary. As for herbs, there is Tribulus tertiaris, ashwagandha, and maca root. These herbs are traditionally used to enhance male fertility, but their effectiveness requires more research.
Our next question, Dr. Leah. What are the rules for sex when you're pregnant?
Be aware that throughout pregnancy, hormonal changes and physical adjustments can affect your sexual desire and comfort in different ways. Early in pregnancy, fluctuating hormone levels and changes in your body might make you feel more or less interested in sex. Symptoms like fatigue, sore breasts, nausea, and frequent urination can diminish your desire. However, some women might feel a heightened sense of sexuality due to these hormonal shifts. During the second trimester, early pregnancy discomforts often subside, and many women experience a resurgence in energy and libido. The belly is still growing, but still small enough to make sex comfortable, and many women find their desire for intimacy increases during this period. As your belly grows larger in the final trimester, sex may become less appealing or physically uncomfortable. Certain positions might be challenging, and your focus might shift more towards preparing the baby's arrival. It's normal for your interest in sex to decrease during this time.
Let's say their interest in sex is still pretty healthy. What are good positions
As your pregnancy progresses, the positions that were once comfortable may no longer be feasible. It's important to find positions that are safe and comfortable, like having the woman on top. This position allows you to control the pace and the depth of penetration, making it easier to stay comfortable and avoid putting pressure on your belly. Lying on your side with your partner behind you is another great option. It reduces pressure on your belly and it can be very intimate. And then having the woman on their hands and knees might be ideal. This position is generally comfortable in the first and second trimesters. However, as your belly grows, you may find it less comfortable. You probably want to avoid missionary. Lying on your back can be uncomfortable, and after the 4th month, may put pressure on major blood vessels, reducing blood flow. And just experiment. Try new angles or use pillows for support.
So it seems like sex is pretty safe, right? So
Yeah.
when would a doctor advise against having sex for a pregnant woman?
If you experience significant bleeding during pregnancy, sex could increase the risk of further bleeding, especially if there's a low-lying placenta or a hematoma. Cervical issues such as cervical insufficiency might make sex risky. If you've had early labors in the past, or if you're carrying multiples, your doctor might recommend avoiding sex in later stages of pregnancy. If your water's broken, sex can increase the risk of infection. There are a few different reasons, so connect with your doctor if you're concerned. Well, Derek, this has been another great show. I loved answering these questions from viewers, but we are all out of time. We'll see you next time on our Sex Talk program, where we answer the questions you've always wanted to ask.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.